All right, good evening. I'm sorry, everybody. Nice to see. I'm so excited to see everyone today. I don't know about you, but I'm so done with Zoom. So it's nice to see smiling faces here, and having this personal interaction is really important. So welcome, and thank you for coming. My name is Maggie Kuriakos, and I am one of the senior advisors at Bridges of Epic at Westwood, along with my colleague, Pete Bruce, who's actually going to be our presenter for tonight. And we're also here with Debbie Higgins from Cornerstone Caregiving. Together we do a lot of these presentations because we feel it's very important to educate the community about the services that are available for individuals and their family members that have mild cognitive impairment and dementia. So although we are Bridges, let me just move this along just to tell you a little bit really quickly about who we are. We are a memory care assisted living in Westwood on University Ave by Amtrak. And we provide care for individuals that have a mild cognitive impairment all the way up to end-stage dementia. We are secure assisted living that prides ourselves in engagement and socialization for our residents. These are just a few pictures just so you can be familiar with our community. We have beautiful outdoor areas, well as a living area as well. We have a huge life enrichment program for our residents. And we are a second family for our families that have their loved ones that are living with us. You can see our residents are very engaged and very happy to be there. As I said, we do a lot of these programs. A lot of our the community that comes to these programs will never have a loved one that comes to our Bridges community, but it's very important to provide this education. We actually had a support group today online on Zoom, and a few of the family members said, you know, we've lost our friends because our friends really don't know what to do or what to say to my wife when my wife, you know, says the same thing 3 times, and they feel uncomfortable. So the families feel a little bit isolated. So that's why we do this education. We really want to educate the community about dementia and what to expect, and that it's okay, and you don't have to feel uncomfortable. So some individuals might be appropriate for memory care assisted living, but for those that aren't and want to stay home with their loved ones, Debbie from Cornerstone Caregiving, I don't know if you wanted to say a few quick words.
Hi, Debbie Higgins with Cornerstone Caregiving. I provide non-medical home companion care with certified nursing assistants, home health aides, personal care assistants. A lot of my staff does specialize in dementia and Alzheimer's care, and it allows loved ones to stay in their home if they so choose safely and taking care of all their personal needs. I'm based right next door in Norwood, and I do have a lot of clients in Westwood, and I'm proud to partner with Bridges by Epic. Thank you for coming.
And most importantly, we do want to thank Westwood Public Library for having us here and bringing you all here and being a part of our, I hope that you think is going to be a wonderful presentation. So without further ado, I want to introduce you to Pete Bruce, who's going to be our speaker. He's a certified dementia practitioner.
Thanks, Maggie. Thanks a lot for everybody to come out tonight. The roads are okay so far, I've heard people saying, so that's wonderful. Just for some housekeeping items, there are bathrooms right outside the door. We also are going to try to, keep it to an hour. Your time is precious. I understand that. Also, we want to have enough time for you to ask questions too. Typically, when we do these presentations, as Maggie's already said, we'll come into a community, and it's really about education. We're not doing any kind of real infomercial or anything, but we do want you to know where you can get some resources. And we have as Maggie said, support groups. And probably with I want to say it was probably 30 or 40 folks that were on there was a Zoom program today for support. And most of those folks are never going to move into our community, but we're doing that as a support because, dementia and caregiving for folks with dementia can be exhausting. It can be exhausting. It can be hard. It's what they call the long goodbye. We are doing this presentation tonight. If you found out that this is here tonight, you probably know that there's a couple other ones coming up too. There's one going to be in February and another in March. We'll be doing a panel discussion as well with a number of people who do support in and around the town, both paid and non-paid. How many of you are here? I have a question just want to throw out. How many of you here just to get some education? That's it. Okay. How many of you are caregivers? Okay, God bless you all. And how many are you just for the food? Oh, okay. You didn't know that there was food. Okay, I get it. But I want to say thanks for Debbie to bring the food in. So that's terrific. So we're going to talk tonight about normal aging versus memory loss. When we do this presentation, a lot of people are curious. Do I have any problem? The other day, I had my glasses on the top of my forehead, and I was looking for them all over the house, and then my daughter said, "They're right there, Ma," or you lost your keys or whatnot. We're going to cover a few things. It's not going to be comprehensive in the fact that it's not going to tell you whether you have dementia or not, or if somebody that you are worried about has dementia or not. One of the things that I would suggest is certainly if you are really concerned about that, go to a PCP, go to a neurologist, and find out that information. There are certain tests that can be done. One of them is called the MOCA, and one of the things that they ask on this on this test are things like who's the president of the United States, or what day is it of the week, what year is it. They might ask questions like, can you remember 3 things, which I'm going to ask you to do too. Cat, ball, pen. Okay, just remember that. At some point I might ask you again. Maybe there'll be a prize or something. I don't know. So memory and aging. So, the biggest enemy of us all is time. As we get older, our brains shrink. It's not true if you have wondered, or has anybody said that you are born with all the brain cells that you have and that's it. That is not true. The research shows that that we can build new pathways in our brains by doing certain things, and we can talk about that. We do presentations all the time on that kind of information as well. Brain health. The next one I think we're going to be doing here, besides this one, is the signs and symptoms of dementia, and that's a good intro to kind of talking about, especially for the caregiver, what to kind of anticipate. But this one, we're talking about memory, aging. Is it normal or not? Time is the worst enemy. How important is it to you? Your stress level, a myriad of other things, which we'll talk about tonight, do affect our memory, both acutely and chronically. Sometimes changes to our memory occur sooner than anticipated, faster than expected. It may be a mistake of natural slowing of the mental process for true memory loss. By the way, so when we talk about memory, I want you to think about it as a file cabinet. So memory, cognitive ability, kind of interchangeable. It's kind of like a file cabinet. When we need to access something, we pull out information out of our brain. So, like for example, I'm looking at my colleague over here, what's her name? And I need to access that file. And it's Maggie. Okay, so I'm in my mind trying to find that word, or it might be if I'm trying to remember how to ride a bike. Some people say it's it just is as easy as riding a bike. Well, it takes practice. So some of these things have been learned physically over time. Learning to walk, learning to eat, learning to chew, learning to swallow. All of these things are usual natural abilities, but folks that have dementia, one of the progressions can be, not always, but can be, those deficits. Not being able to swallow, not being able to remember names, not being able to put together words into a coherent sentence. So all of these things can happen. The hippocampus is a region of the brain involved in formation and retrieval of memories. Often it deteriorates over time. It slows down. Hormones and proteins that protect and repair the brain cells, they stimulate neural growth, also decline with age. So these are all normal things. But there are some things that we can do to kind of keep ourselves a little bit more sharp. Older people often experience a decreased blood flow to the brain, which can impair memory and lead to changes in cognitive skills. Some of these are just through lifestyle. Sometimes it's not engaging in certain activities, so we get a little bit more dull as time goes on. Occasionally, occasional memory lapses can be frustrating, but often it's not cause for concern. It's just part of our life, our whole life. Age-related memory changes are not the same as dementia. If you come to our next session, you'll find out a little bit more in depth. They build upon each other. You can do them one-offs all at if you want to, but if you want to kind of go on with the series, you'll find a little bit more about what types of dementia in the signs and stages a little bit more in depth. The key difference, though, between age-related memory loss, which is normal, and dementia is that age-related memory loss does not interrupt daily living. It's usually 2 or more what they call activities of daily living. If anybody has a question, too, certainly raise your hand. We'll stop. We can talk about it. There'll be a question-answer time at the end. But I don't want you to have to wait. If something gets a little bit more in-depth, we can kind of parking lot it, talk to the side after this session. We can do that, too. Able to perform day-to-day activities and manage work, hobbies, social activities, and family relationships. If there are some cognitive deficits that are interrupting these types of life activities, then it could be dementia. Dementia is marked as by a persistent disabling decline in 2 or more, as I mentioned, intellectual abilities. Memory loss doesn't automatically mean that you have dementia. We talked about that already. How many of us have gone? I was over to Wegmans just earlier today, and I was like, "Where's my car?" And what did I do? But I took out my keys, right? And I'm like clicking my keys because I hear the little beep that goes off. That's totally normal. I hope. I hope. Because I was out there looking around for a while. But what is not normal is coming out of Wegmans and pulling out my keys and I'm thinking, where am I? What am I doing here? So that's a little different. Sometimes even what looks like a significant memory loss can be caused by treatable conditions. So, and they can be reversed. Stress. We know that stress, anxiety, our research has shown that it greatly affects the memory and cognitive recall. Anxiety, depression, they go hand in hand. Many of the folks that live at our community also are diagnosed not only with dementia, but also with some kind of anxiety or depression. Vitamin B12, this is all research-based, but vitamin B12 is shown that when there's a deficiency, that there's a cognitive decline. So there's a statistical significance between the two. Thyroid problems. You know, if someone's on Synthroid, it doesn't necessarily mean that someone is going to get dementia or has dementia, but there is a significance with folks that do have thyroid issues, whether it's hypothyroidism or hyperthyroidism. Certain types of infections, like a urinary tract infection, can heighten the person who might normally interact could all of a sudden start to have some acute behavior issues associated or some kind of disorientation. Alcohol abuse can affect over a long period of time, can affect certain types of folks with certain types of dementia. Dehydration, you know, staying hydrated is an important way to overcome certain types of dementia as well. And cognitive side effects, medication side effects. So with the medications, what I would always defer to is talk to your doctor to see if there are any kind of complications with drug interactions. Warning signs. When I say Alzheimer's or dementia, because Alzheimer's is basically accounts for a little bit more than 50% of all types of dementias, I'll be using either dementia or Alzheimer's interchangeably. But there are some warning signs. So we already mentioned about memory loss that affects the day-to-day functioning. That's a warning, that can be a warning sign. Challenges in planning or solving problems. So we find a number of folks that do come to our community might have been working up till a few months or years ago and now are having difficulty on the job. Difficulty performing familiar tasks like dressing oneself, brushing their teeth, paying bills. Confusion with time or space, and that can affect folks in a number of ways. One in which, you know, forgetting to go outside with a coat on in the middle of winter. Trouble understanding visual images or spatial relations. This can be usually in the later stages of some kind of Alzheimer's or dementia, understanding kind of what's happening, taking information in visually. Usually that's when there starts to be some car accidents and multiple car accidents or falls or things like that. Some more warning signs, new problems with words or speaking or writing. So they call that aphasia. Misplacing things or losing the ability to retrace step. That's probably the biggest one, which we'll get to kind of the this or that. Is it normal aging or memory loss? One of the big things is you might not remember, someone might not remember what they were doing or where they put something, but they can retrace. They can finally come up with, you know, whatever the task was or whatever they were trying to remember. Folks that have Alzheimer's dementia have a much more profound difficulty recalling things. Poor judgment can be a warning sign. Withdrawals from work or social activities. We know that, you know, definitely in our field, we saw a huge uptick in more folks looking for support, not to just move into a community like ours, but or going into getting some home care or whatnot. But there's some statistical significance between folks that are isolated. Now, we just came out of a huge pandemic, so people were home a lot more by themselves. People weren't able to freely go from one place to another. So it increased the isolation, decreased social activities, which really had an effect on folks' cognitive ability. Changes in mood and personality. So a person who has been pretty easygoing for a very long time, if you see some changes in mood, that also could be a warning sign. And there are certain types of dementia that are even more profound and heightened that you might see, things like Lewy bodies or frontal temporal lobe. Yes, Jim?
I wonder if you could explain the differentiation between Alzheimer's and dementia and memory loss. I'm not sure where Alzheimer's is.
Sure. Good question, Jim, right? Yeah, he asked, what's the difference between dementia? So think of dementia as an umbrella. Alzheimer's is one aspect of dementia. But like I said, it's one of the largest diagnoses. So I usually will say Alzheimer's because everybody knows what pretty much that would be. But it is an aspect. There's over 100 different types of dementias out there. With memory loss, I would say that memory loss it could be lots of different things. I have memory loss. It's more of I don't want to say it fits into, it's not a diagnosis. Someone won't have just a diagnosis from a doctor or a neurologist about memory loss. It has to be more of a clinical diagnosis. If I don't have an answer to something, by the way, I'll try to get you the answer. Short-term memory differences. So this is where it's the this or that. So we're just going to go through these. This is either normal aging versus memory loss. So sometimes forgetting a name or appointment but remembering it later, it's normal. Forgetting names of close friends or family, or forgetting recent events like visitors you had that day or what you had for dinner, could be some kind of cognitive issue. Occasionally forgetting something that was on the tip of your tongue versus mixing up words such as saying bed instead of table. That could be a sign of memory loss. Occasionally forgetting something that you were told. It's fine. Asking for the same information over and over and repeating it after it's already been addressed is not normal. Occasionally misplacing items like your phone or your glasses, things like that, as opposed to misplacing things often and being unable to find them, or putting things in unusual places, such as, a hat in an oven, or gloves in a freezer. Forgetting parts of an experience. It's fine, normal. Versus forgetting an entire experience. It can happen. Forgetting where you parked the car, fine. As opposed to forgetting how to drive a car. Some more examples of this or that. Being slower to react. It happens, and it can happen for a lot of different reasons. We talked about, it could be drug interactions, it could be an infection, all these different things that are more acute, as opposed to getting very confused when planning or thinking things through. It's more global. Becoming less able to manage multiple tasks, especially when distracted. As I mentioned, stress can kind of short-circuit us all when we have a lot, especially coming out of the holidays too. It's kind of like almost like a hangover at this point. But that's normal. What's not normal is the inability to complete tasks independently, or taking much longer to complete everyday tasks, such as following a recipe, paying bills, taking medication, or shopping. Some more examples, making a bad decision once in a while, it happens. As opposed to having frequent or poor judgment, especially when assessing risks or behaving in socially inappropriate ways. That doesn't happen with everyone. Like I said, there's some forms of dementia, there is a behavior component that's pretty profound. Occasionally missing a monthly payment, as opposed to having trouble keeping track of monthly bills or keeping a budget, especially if it was something that they did all the time. Many having trouble finding the right words sometimes, as opposed to frequent problems finding the right words and often incorrectly referring to objects, such as, instead of a watch, calling it like a hand clock. Needing to concentrate a bit harder to keep up with a conversation. We find that does happen. So folks, if they're having difficulty with the second one, having trouble following or joining conversations, the first one is normal. The second one is not. And we find that goes along with when folks are not able to keep up in a conversation, they become more isolated. And so it's kind of like a snowball effect. Losing the thread of if you're distracted or there are many people speaking at once, too much stuff going on, too much stimulation, sometimes can be difficult, but it's normal, as opposed to difficulty following the flow of a normal conversation, even one-on-one. Orientation differences. So becoming confused about the day or week, but figuring it out later, can be normal, as opposed to losing track of the date, the season, the passage of time. This is not normal. Walking into a room and forgetting why you were there, but quickly remembering, again, is normal. Versus not knowing why or where you are in a familiar place. Temporarily forgetting a destination or pausing to remember directions versus getting lost while walking or driving in familiar areas. So this is all, as we're going through all this, these are all breakdowns of what a neurologist would be looking for if you went in for testing. So it's broken down into orientation, into visual perception, time and space, all of that. Vision changes related to cataracts or other changes in the eyes, totally normal, as opposed to problems interpreting visual information. So it could be difficulty judging distances on a stair, so much more of a fall risk. Or misinterpreting patterns or reflections such as seeing water in the shower, or not recognizing themselves in a mirror. These are typically things that happen in later stages of a cognitive impairment. Difficulty determining color or contrast can sometimes be an issue as well. Mood or behavior is another kind of area that neurologists look at, or if you start to suspect that there's some issues with a spouse or a friend or a mom or a dad. Sometimes being wary of work, familiar, and social obligations. We're all busy, our bodies can only take so much. As opposed to becoming withdrawn and losing interest in work and socialization and hobbies. Like I said before, you talk about the file cabinet, pulling out information. All day long we do this. And after a while it can get exhausting, especially if we have a lot on our plate in a day. But if you can think about a person who is having difficulty accessing correctly this information, it can be exhausting. So by the end of the day, or even at the beginning of the day, after one or two tasks that are usual normal, it's taking a lot more effort. So what can happen is folks start to say, I'm done. Often we'll have folks who are looking for help that come to us, say, I need help with my husband or my wife or mom or dad, and saying that they need help with different types of activities because they can't do these anymore. Or sometimes at work, some employers say, I'm not sure if you can still do this job. Sometimes feeling a bit low or anxious. We talked about, mood and behavior. That's okay. We change in the season. Seasonal affect is, I don't know if it's a disorder or not, but, we have these things called circadian rhythms, too, that can change our mood over time. That's normal. As opposed to getting unusually sad or anxious or frightened or low in self-confidence. Not as normal. Developing specific ways of doing things and becoming irritable when the routine is disrupted. That's me, actually. I like to be a creature of habit a lot of times. But what's not normal is becoming irritable or easily upset at work or with friends in a comfortable or familiar situation. Typically what we find working with folks who do have dementia, it's usually some kind of unmet need, either that someone is hungry or angry or lonely or tired, or if there's pain or this frustration of some sort. It's usually that's when we see that there's some kind of mood that is associated, an adverse mood. In certain times of day, too. Has anybody ever heard of sundowning? Okay, so that can happen too. Coping with a diagnosis. So it can be difficult, but I think some of the key things to coming, if someone was to take, if you were to go with a friend or a relative or a spouse or whatnot to a neurologist and there was some kind of diagnosis, it can be difficult to deal with that. The thing is, you get a lot of supports in and around Westwood to help with that. Senior center, there's some day programs, there's the elder services, all of these. But coming to terms with memory loss and the possible onset of dementia can be very difficult. As Maggie said, there's a lot of folks that we work with who say, I'm at my wit's end, I don't know what to do. Either it's themselves or it's a spouse. It's important to know that that person is still a person and that they still have a long life. We have a number of folks that have been at our community or at Bridges in general who still have wonderful lives and they have full lives. It's not a death sentence in the term of folks. There are lots of things that can be done to sustain someone to have a full life still. The one thing I will say, though, about dementia is that it is a disease. It is progressive. It is progressive, and it is fatal. But at the same time, folks, if they get the support that they in an early diagnosis, folks can still have a pretty full life. Family members, this happens a lot. Family members who are caring for their loved one, they overcompensate for someone's deficits. And what it does is it leads to caregiver burnout. So if one thing I can say, too, about that, when someone has a diagnosis or caring for someone with a diagnosis of dementia is, don't forget yourself, too, in this whole process. We have lots of support that we can offer both at our community and also just as a resource, too, for folks. Dementia is life-altering, but with intervention, especially early intervention and education, like what we're doing here tonight, planning and support, a person can gain acceptance of a situation, be prepared to face the challenges that come their way, and that they don't have to do this alone, ultimately in having a better quality of life with dementia. It's a rotten disease, but at the same time, there's a lot of information out there. There's a lot of support. If you were to look at where we're at now as opposed to 20 years ago, it used to be one option for folks, or even 20, 30 years ago, it was one option, and that was nursing home, perhaps. There's lots of different options today. That's the kind of the portion of the presentation. You all might have some questions that I would love to answer. If I can't answer, certainly Maggie could answer them, or maybe Deb. But if we can't get you an answer, we'll get you one. So the other thing I will mention to you is we do have a sign-up sheet in the back. You do not have to sign and put your name and number, but what that will do for us is we can send you this presentation. And if we call you or email you and you say, hey, Pete, Maggie, I don't want to be called anymore, I just want that presentation, totally fine, okay, not a problem. But what we can do is to provide that this PowerPoint. You can share it with anybody you want. If you want to come to the next one, you certainly can write on the sign-in sheet that you would like to come to the next ones, RSV even now. So that's fine.
You guys feel better than just normal memory loss? Do you make you feel good?
What questions, Jim?
Your facility, about how many people are there currently?
We have 72 residents there right now. That's the capacity of our community. Some other communities that are in or around the Westwood area, Norwood and Dedham and whatnot, a lot of times they have assisted livings, and there's a small memory care, but we are all memory care. So these other places, they might have, an assisted living, and there might be 12 to 25 folks that have memory care needs. But we're all memory care. We have folks that join us with very early onset dementia, where they were just working and driving and all of that, just up until a few months ago. And then we do help folks through end of life as well. So yes, sir.
You mentioned at the beginning that one of the symptoms in advanced Alzheimer's, that can get violent.
There can be what is your name, sir?
Dan.
Dan. And I gotta say, Dan and Eileen, the best, because you know why? They sat in the front. Nobody ever sits in the front. Nobody. I've done this for a long, long time. You guys are the best. Yeah, maybe. Or you could take some cookies or whatever. Yeah. So the question is there an element of violent behavior that can be associated with dementia? Like I said, there's 100 different forms of dementia, right? There are some certain ones that do have that element of behavior issues. One could be Lewy bodies, that's what it's called, frontal temporal lobe dementia. That can have an element. And there are things that neurologists, doctors will prescribe medication-wise. We haven't really even talked about medication, but there are some good medications out there. There's also there's techniques that can be used to help to redirect folks away from, like I said, some kind of unmet need, usually. Folks who are having difficulty with loss. So dementia is a big loss. So a lot of folks that we work with have already lost the ability to go to work, or they've retired. Their children have left the house. They're having difficulty with their own physical capabilities, walking, and they might have lost a spouse. They might be having difficulty with bladder control, bowel and bladder control. All these things can lead someone to having mood changes, and that is something that can be mitigated in some way. Some things not. Some things are organic that do help. Medication does help. So.
But in your facility, you said it's all Alzheimer's. At a point, if there is problem with the person? Do they send them someplace else?
Yeah, it's a good question. So with our particular community, and I will say in general, any assisted living or memory care assisted living in the state of Massachusetts, they're not equipped for folks that have violent tendencies. So if they're a danger to themselves or others, that's a big key point. We will not have folks live at our community. If they're already living there, the chances are, if they haven't had any outbursts like those, they probably won't. That's a general statement. Dementia, the most predictable thing about dementia is that it's unpredictable. It changes. So I don't want to say it's like that for everybody, but if someone was to be having some kind of aggravation that leads to agitation, that leads to a violent outburst, I'm not talking about someone pushing someone. I'm talking about picking up a chair and, or whatever else. That's a whole different category. And many folks will go to what's called a geriatric psych unit, like McLean Hospital has one. BID Needham has one as well. So there'll be places where they can get some med adjustments or some support that way. So, yes.
Can clients have hospice if it's needed?
Yes, clients can have hospice. We have 2 or 3 hospice companies at our community. Most assisted livings are very similar in that they do have hospice services. We do as well. Yep. So it really runs the gamut. Folks who live at our community, that's their home. So just like Deb has cornerstones and works in the home, she has connections, I'm sure, with hospice companies as well. Correct. Actually, yes. The insurance picks it up. Yeah. Yep. So if you had a loved one who needed hospice services and they were living at home, you would do the same thing that we would do and talk to a hospice company to come into the home as well.
Does Medicare pay for any of this assisted living?
For assisted living or for hospice? It's very rare that there are places that will take places like us that will take insurance to pay 100%. So long-term care insurance absolutely does. We probably have about 60-70% of folks that do live in our community have long-term care. Yep.
And I think what's really important for the presentation, pizza, this is one of 4 pieces of our presentation. And I think what's really important is educating on what dementia is. There's so many different types. There's no one size fits all. Just because you have this particular type of dementia doesn't mean this is what you're going to exhibit. It's very different for everybody. And really the key is loved ones, family members, friends, best friends to really kind of understand the disease and understand this is about them, not about you. So a lot of our families that come to us, they're like, well, my wife was so lovely, we kissed each other every day and hugged every day, and now she's swearing at me. And so this isn't because she doesn't love you anymore, this is the disease. And so we teach families how to adapt and how to have a different approach. And with these different approach in this teaching, and the understanding of kind of what you're dealing with, it allows for a much better cohesive relationship and interaction. And it gives a caregiver a better sense of self and happiness.
Hmm.
It is very difficult.
It's a good point. Education is key when you're working with folks that, or whether they're family members or not. Working with folks that have dementia can be complicated, but a lot of these strategies are pretty simple but effective. We do a lot of presentations for various social services. One of them being the police. So we just did the Westwood Police, and and they found it. We actually did it twice, and we found that it to be helpful for the police officers when they're going through our training like this. Ours was more about effective communication. So when a police officer comes up to a person who has dementia or suspects that there is dementia, that there's a different way to treat those folks, as opposed to someone, you know, who might be agitated. Most of the reason why someone might be agitated is they don't know where they are and they need help. Any other questions? These are great questions. What does it cost? So it can cost anywhere from $9,000 to $12,000 per month.
9 to 12?
Does long-term insurance cover all?
Yes, it does. Mm-hmm. A good portion, yep. Mm-hmm.
What happens if funds run out while
Yeah.
somebody is living there and you've capped?
Just like many other communities as well, there are private pay communities. There's typically we will look at 6 months out if there is a dwindling of funds. You know, typically someone gets to the point when they have no more funds, then we would assist them in looking for a place like a nursing home. Yeah.
So there's only one caregiver here, is that true? One caregiver. So you, 2 caregivers, oh.
So, have you guys experienced like the isolation with friends or families? That's been.
What I've done is made an extra effort to use text messages, sharing photos. We recently had, last August, our first grandson. And so that's been a bright spot in an otherwise, you know, very challenging life as we have at the moment. But sharing photos, sending texts around holidays, just reaching out and reassuring people, you know, that you know, we're still here and that sort of thing. And when we can, you know, try and attend family gatherings we just had Christmas again this year. It's going to be the last one because it was so difficult.
Yeah.
But you know, after 47 years of marriage, and you know, you have your best friend that all of a sudden is having these challenges, you really go the extra mile to try and exercise as much patience as you can. But I can tell you for sure, you use words like overwhelming and exhausting. Those are all very applicable. But you have to do it. And the challenge for me is really, you know, pulling yourself back inside when you're confronted with all this anxiety, and just trying to calm yourself first, and then trying to reassure and redirect some of the, you know, the negativity, because there is a lot of frustration, and they don't have control of a lot of things anymore in their lives. So I try to allow a lot of flexibility and a high degree of acceptance of finding things like the keys in a freezer, or, you know, her sitting in the car for an hour, and you go out and, you know, she just doesn't remember anything. And so those are all very sad, frustrating things, but they still have to, you know, take meds and go to bed at night and put new clothes on every day. And, you know, and I make an effort to try and bring her out and interact where we can. Not, you know, sometimes if you're in a store or something, you know, she can be very distracting. But just to expose her to some of those things still. But, so we do make an effort to reach out.
You touched me.
Yeah, exactly.
We deal with families just like you. It's art, is it art? So we deal with folks that are struggling with this every day. And nobody who has a loved one who has dementia, living with dementia, ever signs up for this. But it's the kind of, you know, in sickness and in health, all of that goes along, and I give you all the credit in the world, you know. And there's other folks that are dealing with this as well, and I would encourage folks, if you're struggling with this, is to be a part of a network of folks that are doing the same thing, so you're not alone. There's a gentleman over in Sharon that has been on our support group. His name's Larry, and he's been dealing with the same type of thing I met him 2.5, 3 years ago, and he said, Pete, I'm looking at your place, but, I don't think, I don't know. I want to keep my wife as home as long as they can, because I made that promise to her. And, Larry did right by her. She stayed in the home, and he brought in home care. And really work through that, because it was right for him. It was right for them. And the part of it is it's kind of like on the airplane, they say, when the airplane loses oxygen, what do? You first put the oxygen on yourself so that you then can help. So it's important to have those supports in place. Definitely helps to have those supports in place.
And realizing that if you don't take care of yourself mentally and physically, you can't take care of your loved one. So you do have to find that oxygen and realize that you have to be number one. And then you're able to care for her. But our Zoom support groups are amazing. We do have a facilitator, but they run the loved ones, the caregivers. They run it themselves. They are so helpful. They're supportive to each other. One person has this issue, and another family member says, "Oh, I had that issue last month, and this is what I did for my husband, and it worked, and it made me feel better, and my husband felt better." Or I have these feelings of frustration, and I get mad at myself because I shouldn't be mad at my wife. This isn't her fault. But that's normal feelings that that caregivers have. And to appreciate your own feelings and understand those, I think, are really important. So we had one today. We have them monthly, and you can get on from the comfort of your own home. You can be on Zoom, or you don't have to. You don't have to show your face. You can just listen. And the families are so incredibly supportive of each other. And we have probably about every month. We probably have about three new family members coming on, because one family member tells this person, and then they come on and they're with us. They're with us for life. So it's really, really a great environment, and we'll make sure that we get your email, and you'll get those email so you can sign yourself up. They're really, really helpful.
Yes. We have a doctor that oversees nurse practitioners at our community, just like all communities, and they make house calls to our residents. It is picked up by insurance as well. Mm-hmm.
How about like activities during the day? Like my dad would sit and not want to partake in anything. Do you have staff? Yeah,
we have staff. We have a whole array of activities that span all types of interests. For folks that had interest in certain things when they were younger, and also we modify activities for what they can do now, whether if there's a physical limitation. We also have field trips out into the community as well. One of the great resources, and I've had folks say, I don't know if they'll ever do this, but there are some, if you look up memory cafes, they have one at the Westwood Senior Center. There's a day program called Julia Ruth House. I don't know if people know about that. There's some great resources. If you want a whole list of places, we can certainly provide them to you for sources. Whether or not you think Bridges, and this is, like I said, it's not an infomercial for us. It's really about services for the community at large.
We love this. We love helping.
Yep.
How's the food?
Very good. Very good. It's very good. Yeah.
But the big thing with Bridges is the engagement. So life enrichment is our focus. That is what we do, and that's why our residents live with us, because we keep them engaged and social and involved.
Yeah.
And the other piece of that is when families make that very difficult decision to come to a memory care, assisted living, come to Bridges, they have a lot of guilt, and they're like, I'm not sure how this is going to work. Is this the right decision? But when after the loved one transitions, they get involved in life enrichment programming, they meet other people, the families meet the current families, and they're like, oh my God, now I can actually be the wife to my husband. Now I can be, the friend. Now I can be the sister to my brother. And they get their life back. They get that relationship back that they didn't have before because they were a frustrated caregiver. And so they have a whole new life. And so it's extremely helpful for families, as obviously as well as our residents.
Yeah. So one person had asked me at another in another talk was what's the difference between a nursing home and what you all have, Bridges, or even an assisted living or whatever. And I say that we're a social model. So as we talked about, one of the big problems with dementia is when people isolate. So hence, we're a social model. We want to do everything that involves around. I mean, you can replicate a lot of these things as well, and that's why you have the senior centers and there's day programs and folks. I know some families who get very creative and get together and do activities. 2 families, 3 families together who have dementia. Folks who are living with dementia, you can do a number of these things, but it's important to be engaged socially. The difference between us and like a nursing home is it's a medical model, so they're concerned about keeping folks alive in the bottom line. We offer a lot of the medical enhancements as well, like 24-hour nursing and things like that, and we can do things with medications and whatnot. But we're a social model because we know that research shows that when you have a vibrant array of activities, not only from a physical standpoint, but an emotional standpoint, a spiritual standpoint, all of these come together, so it makes the person's life much, much more fulfilled. Yes, sir.
So people are thinking about in-home caregiver versus a facility like you're saying. You mentioned one of the examples that you brought up around that was something that met their kind of profile. Are there any kind of criteria that people kind of go through and say, this is the point where I have to make this decision, or are there some guidelines there that kind of really determine what the right decision might be?
Yeah, it's Maggie said it's personal. It is personal. However, we do a presentation on is it time, and there's no formula to it. When families do come to my community, I'm sure, Deb, if you want to talk about as well about when is it time for home care, I use this with families, is that what's your pain point? What's your pain level? And what I mean that is that is it affecting you? Are you getting the 26 calls a day because you're not able to go over every day? Are you having to clean up messes, bladder and bowel constantly?
Are you hospitalized? Do you have diagnoses that you didn't have before? Is it affecting your own personal health?
Doctors will many times will say to the caregiver, you're going to have a heart attack if you don't do something about this, because they're so stressed out.
That's where Debbie can come in, where if you decide that assisted living cares, you're not ready for that, then Debbie at Cornerstone Caregiving provides those in-home services, so you have that extra support and they can stay in their home.
And going back to pain points, one of the things, if it's disrupting ability to go to work, you're getting calls, you have to leave work all the time. I've had clients that had to quit their job or take FMLA. One daughter had babies, little young children, but she was spending all the time at her mother's home, sleeping over. That's life disrupting. Another big one that I personally see in home care is safety, right? My big three, because my dad died of cancer, my brother of a brain injury. I've been through things other people have. Everyone has a story. If you kept them safe, surrounded by love, right? And pain-free, those were always mine. Then I made a ton of mistakes, but if I did those three things, I did okay, Dad. Right, Dad? So you're doing okay, and you need to hear that. But the other number one thing from home care perspective that I see people is their loved one can no longer be, that safety factor that of the big three is no longer. I have a client whose father, they had to unhook the stove and take his shower head off. They made him a little in-law apartment in the basement. He almost burnt the house down, God bless. Right? Or my person that I had to sit the daughter down and said, you have to, this isn't sustainable. We came to take care of your dad. And he was face down in the living room on the floor and had probably been there all night, living alone. God bless, he had Alzheimer's. And the daughter, I promised him he could die in his house. I promised him. Well, now we're talking about his safety, right? So it is just what you said. The guilt, I see the guilt, their personal pain, they're getting sick, they're sacrificing so much for their loved one. And you have to save the sinking ship, right? Because it's like that one person's going to take the whole ship down with them. And if they were cognitively the mom or dad you knew from 10 years ago, they wouldn't want that to happen. And that's the other big thing I see. A lot of people have a hard time, and it's horribly devastating to let go of my dad that I knew 20 years ago. So I'm treating and judging the situation and my dad and the decisions I'm making about my dad based on my dad that I had 5 years ago. He's not my same dad anymore, right? And I know it's happened to me, and I'm sure all of you are, you become the parent. And that's a hard role, right? Or if you're the spouse, even, you become the parent to your spouse. And so it's not loving them so that you're loving yourself to death, loving yourself to death. And going back to what you said, it's personal, what each person's pain point is. But one that I see going into people's homes a lot of times is the being stressed out, strung out, having no life as the caregiver, and conversely, the safety of the person themselves is now at jeopardy, and possibly even everyone in the home, because of behaviors that are out of their control.
And one big thing just to leave you is that children, adult children or spouses, a lot of times when we're meeting with them, they say, I can't do this to my mother. I can't do this to my father. And I say, no, you don't understand. You're doing this for your mother or for your father. This is beneficial to them. Don't think you're doing a bad thing. This is absolutely necessary, and it's for their greater good. And that's what I always try to tell my families.
We have time for maybe one or two more questions, and we will be around for a little bit afterwards. Does anybody have any other questions?
What are the initials after your name?
Oh, well, my name's not up there, but CPD, the dementia practitioner, certified dementia practitioner.
And also a trainer.
It is a license. It is a license. It's a license to train as well, like we're doing tonight. Yeah. Yeah.
Is there a certain staff to resident ratio that you like to follow?
So we talk about ratios. We talk to families a lot about ratios. Those are really about nursing homes. Use those ratios. At our community, we have staff 24/7. So does a lot of places. And but the ratio doesn't equate, because what happens in a nursing home is that they're specifically with those patients. Our staff helps, so there may be 3 or 4 folks helping all together the residents. That's what we call our residents, not patients. And so some folks are at different needs. Some are very high functioning. They don't need any help but a little bit of prompting and cueing. And then we have other folks that need significant help, like a 2-person assist or Hoyer lifts or feeding, things like that. So it doesn't equate totally. What I would encourage anybody, if you ever want to come down the street and take a look, even if it was 5 minutes, you're more than welcome to do it. We have some folks come in for 5 minutes, take a look around. We have other folks that stick around for an hour and a half. Totally fine, whatever you want to do. So,
On your way to work.
yeah.
What about like a wandering person, somebody who takes off or?
Yep, you mean at just in general? So, okay, so there are some things that you can do. We have presentations on this as well, but in a nutshell, we do have folks that do wander at our community. However, they can do it safely. So if you do come down to our community, we are a secure environment. So we have, so our staff is always with our residents, 24/7. But the way our community is designed, which is designed around all with dementia, they can do it safely, even going outside, because it's a safe environment as well. It's secure. So it's an incredible design that really allows folks to have the dignity to still live their life, but to do it safely.
And a level of independence.
Yep.
Yeah.
I asked 3 questions, or what were the 3 things that I asked earlier? What were they? There you go. All right. Fantastic. All right. So I'm going to, if you put your information down, I will send you something. I also, though, have another thing. If you have that pad of paper, and if you turn it over, there's an X on one of them. All right, Jim. So I don't know if you like to read, Jim. He's got it on there. I can see it from here. We got this awesome book, and there's a ton of great books out there. If you want Maggie and Pete's top 5 books, let us know. We'll share that information. But one of the books is called The 36-Hour Day. Now, I'm going to tell you right now, don't read it cover to cover. You can skim through it, find different parts that are appropriate to your situation. But this 36-hour day book, it's basically for the caregiver who's having difficult time. So I'm going to give it to you, Jim, so you can. All right, and we're going to send you some information as well. So yeah. No, Maggie wanted me to autograph it, but I didn't write it. So yeah.
Curious question. Jim, have any residents now they've left their family, they don't know them,
Yeah.
and now we're going to make friends at this new facility, which is, and you get another one comes in the same situation and they fall in love and want to get married.
I have never had that experience where I've met folks that have come together and married together. I have not, but I have heard of it. Not as much in memory care assisted living, dementia specifically, but I have seen folks have a new love story at an assisted living. Yeah. Well, thanks a lot for coming tonight, folks. Please join us for our next installment, okay? All right.